Good afternoon, I'm Cheryl Miller. We're interrupting CBS 6 programming to bring you breaking news from Capitol Square here in Richmond. That's where Governor Northam set to make what he's calling a major announcement about Virginia's response to the coronavirus pandemic. Here is the governor.
Hand washing are our best tool to combat the coronavirus. Most Virginians recognize this and are complying. But I'll say it again because I want everyone to hear me. Stay home. Across Virginia, in the past few weeks, we have seen people doing the right thing to help their neighbors. We have seen people making masks to help our medical personnel. We've seen teachers driving through their school neighborhoods so their students can see them and feel connected. We've had more than 1,600 volunteers apply to our Virginia Medical Reserve Corps just since last Wednesday. Please visit VAMRC.org if you are able or willing to help. All of these things make me so proud to be a Virginian. In this difficult time, Virginians are stepping up to support their neighbors and their communities. We've also seen people adhering to the rules about social distancing, but it is clear more people need to hear this basic message: stay home. Our doctors, nurses, and other medical professionals are putting their lives and health at risk every day, working to help people who are sick with this virus. I am so very grateful to all of you. But this weekend, some of our beaches and other recreational areas were literally packed. Everyone who is gathering in a crowd at any place around the state is putting themselves and others at risk. So today, I'm announcing a stay-at-home order for all Virginians. Under this order, everyone in Virginia must remain in their place of residence unless they must go out for food, supplies, work, medical care, or to get fresh air or exercise. Any parties or social gatherings of more than 10 people are prohibited. Private campgrounds will be closed for short-term stays. Virginia's beaches will be closed to any activity except exercising or fishing. All institutions of higher education will cease in-person instruction and cancel any gathering of 10 or more people. If you can work remotely, you need to do so, and companies need to allow that. I want to be clear. Do not go out unless you need to go out. This is very different from wanting to go out. Don't go to the store just for one thing. Wait until you have a whole list of needs. If you are traveling from out of state, particularly a hot spot, I urge you to self-quarantine for 14 days. As of today, almost half of the COVID-19 cases in Virginia are in people under age 50. Every age group needs to act responsibly and stay home. No age group is immune to this virus. These orders are necessary to protect public health. As of this morning, Virginia has more than 1,000 confirmed COVID cases. We know that number, unfortunately, will continue to rise. What we're seeing now is the result of how people interacted 2 or 3 weeks ago. What we will see a few weeks from now will be determined by how people behave today and in the following days. We need everyone to be patient with social distancing. It will take time to show results. That's why it is so critical that we all do our part and stay at home. We must do this to slow the potential medical surge for our hospitals. Virginia's hospitals have approximately 18,500 licensed beds. About 2,000 of those are ICU beds. How many more we need depends on the actions that we all take right now. but we know we will need more. We are looking at several different models from FEMA, from various universities, and others. Each one shows different outcomes and timelines. We are working to unpack those and better understand their underlying assumptions and predictions for Virginia. That effort is happening every day, and we expect to be able to share more information with Virginians soon. The one thing the models all have in common, however, is that Virginia will face a surge in cases that require hospitalization. Our efforts have been focused on running ahead of that surge, trying to make sure that our hospitals are ready. That's why we're working with the Army Corps of Engineers to identify sites for temporary hospital facilities. The Corps has been assessing potential sites, and I expect the recommendations will be to me in the next few days. And that's why our hospital systems are also preparing for temporary bed capacity. I'll give you 3 great examples. Mary Washington Healthcare in Fredericksburg has established a field hospital on its campus. VCU has identified a student dormitory on campus that was originally built as a hospital, and they'll use that to treat COVID-19 patients who need to be in the hospital but don't need to be in the ICU. In Southwest Virginia, Ballard Health System has designated Lonesome Pine Hospital in Wise County as a COVID-19 treatment and quarantine facility for acute care patients. Last week, I directed our hospitals and medical facilities to postpone all elective surgeries to save PPE for emergencies and COVID response. Again, the number of cases and the need for hospital care can be reduced if everyone stays at home. Now I'd like to update you on a few other issues. Last week, we applied for Title 32 status for our Virginia National Guard, and that was approved Friday night. That means the federal government will pay for National Guard activities supporting our efforts right here in Virginia. Today, we will submit to our request for Virginia to receive federal major disaster status. If we receive it, we'll be able to provide more disaster-related unemployment support, legal services, food assistance, transitional sheltering assistance, and more. Our Port of Virginia remains open, which ensures that shipments of critical supplies are getting in. The port is prioritizing those shipments of personal protective equipment. We have also received USDA approval for our statewide household disaster feeding program. This means our entire Virginia Food Bank network can offer emergency food assistance to anyone in need of food, not just those who meet income guidelines. This is an important change because it means our food banks can serve approximately 200,000 Virginians who need help. Our food distribution sites have seen a 20 to 50% increase in visits during this outbreak. Visit vafoodbanks.org. I'll repeat that, vafoodbanks.org for more information on food bank services. If you need help getting food or other social services, call 211. I also want to remind Virginians that our domestic violence services are still available to those who need them. Call the statewide Family Violence Hotline at 1-800-838-8238. As I have said for the last few weeks, and as I am explicitly stating today in this executive order, I ask Virginians to stay at home. We understand that you may need to leave to get groceries or to seek medical attention. However, you should stay home to the greatest extent possible. Paired with adequate social distancing, staying at home is an important way to combat this virus. The key here is education. This is a community-wide effort, and I am depending on all of you to comply. As I have said before, we are at the beginning of a period of sacrifice. This is an unprecedented and difficult time, and it will be hard for people. I understand that. But I have faith in you as Virginians. We need everyone to take this seriously and act responsibly, and we will get through this together. Now we hear a health update from Dr. Lori Forlano, our Deputy Commissioner for Population Health, and then we'll take your questions.